Most people experience a fall at some point in their life, which often results in little more than embarrassment. However, as we get older, falls can become more common, and the consequences of a fall can become much more serious. Falls can result in suffering, disability, loss of independence, and a decline in quality of life. Each year, around a third of people aged over 65 and half people aged over 80 experience one or more falls. Older people living in care homes are 3 times more likely to fall than older people living in their own homes. There are 10 times more hip fractures in care homes than in other environments. Many factors can contribute to this heightened risk of falls and harm from falls, such as physical frailty, the presence of long-term medical conditions, physical inactivity, taking multiple medications, and the unfamiliarity of new surroundings. Despite this, falls are not an inevitable part of getting older. In many cases, taking the right steps at the right time can prevent falls and enable an older person to continue an active life. Care home staff have a key role to play in falls prevention, but they need to have knowledge and understanding and the support of the wider health and social care team. Falls prevention is everyone's business.
The Good Practice Self-Assessment Resource provides the answers to many of the questions care home managers have in relation to the prevention and management of falls and fractures.
The aim of the resource is to support care homes to implement a person-centred approach to manage and reduce falls and fractures, which in turn can help improve an older person's quality of life.
The resource includes an introduction to the topic of falls and fractures in care homes, a self-assessment form and guidance, and resources and tools for use.
The self-assessment enables you to compare the working practices in your care home with what is considered good practice. This will help you recognise quality care you are already giving to the residents in the care home and consider new ways of working which both staff and residents will benefit from.
The self-assessment covers 7 areas: supporting documentation, including policies and protocols, falls and fracture risk assessment and care planning, actions triggered by a fall, recording and reporting falls, gathering and analysing information, falls and fracture prevention actions, service provision to the care home, and education and training. Step 1. Complete the self-assessment questionnaire. The manager of the care home or a senior member of staff should do this. If possible, it should be completed with a colleague, so you can then consider the responses together. Each statement in the self-assessment describes a practice to help reduce the risk of falls and harm caused by falls. The statements listed in the self-assessment are all important and achievable. Work through the statements and consider whether this practice takes place in your care home.
Step 2. Write an action plan to address a gap. To address any gap in good practice, following completion of the self-assessment, list all identified gaps on the summary action plan provided.
Don't be discouraged if you find you have several gaps. A 100% score is achievable, but you may need a step-by-step action plan. Following discussions with colleagues and the wider multidisciplinary team, you can decide the order in which you will address these gaps or improvement areas over a realistic time frame.
Starting with your immediate priorities, complete a separate action plan for each improvement area, recording the date when you plan to have completed the actions. To help you decide the actions you need to take, the resource provides guidance, information, links to resources, and points to consider for each statement in the self-assessment.
There are also a number of tools included in this resource which can be used to help you to improve the management of falls in your care home. You're not expected to use all the tools unless you see it necessary. You can print off the tools and use them freely. A tool in the pack may be similar to one that you use in your home already. It may be useful to compare the two, As a result, you may continue to use your existing tool or change to the examples provided.
Review your action plan on a regular basis, keeping them up to date as work progresses.
All care homes for older people in Scotland will be issued with the resource on a USB device and also a Falls Awareness DVD which highlights the key points in the Good Practice Self-Assessment resource.
Services can use this resource during the induction of new staff to promote the importance of falls prevention and management, to support training and education in relation to good practice, to assist continuing professional development, but most importantly, to improve quality of care.
Health and social care representatives across all sectors with specialist knowledge have worked together to develop this resource. 7 care homes across Scotland then trialled the resource. Their helpful comments and feedback have shaped the content and design of the final resource.
One care home manager commented, "It does change practice and involves the whole team."
The resource can also be downloaded from the professional section of the Social Care and Social Work Improvement Scotland website.
Falls prevention.